All right, great. So as I mentioned, our webinar is being recorded, and the recording and slides will be available later on today. Again, welcome. I'll share a little bit about the Latino Commission on AIDS, the organization I work with. My name is Judith Montenegro. And I forgot the logistical part, the rest of the logistics. If you're in a particularly noisy environment, we ask that you mute your phones. I've already muted some of your phones, so if you find yourself speaking and there's no response, it may be because your line is muted. What I will do is unmute those lines that I have already muted now, and if you could mute your phones manually, that would be really helpful. So I'll give a moment for that. Again, if you're in a particularly noisy area or an area with some background noise, we just ask that you mute your phones. If not, I can also mute them on my end.
It was really good. I'm sorry, y'all, if y'all hear this. I can't. Okay.
So some of the other logistics of our webinar, we have an option where you can raise your hand to ask a question. We also have a chat function. Please feel free to use either, and we will either address questions at the end of each of the presenters or at the end of the session, and I'll let Lee sort of handle that. But again, my name is Judith Montenegro. I work with the Latino Commission on AIDS on their Latinos in the Deep South program. We've been working in the Southeast for several years now, and for those that are not familiar with our program, it is a regional program in 7 states, and we have a satellite office in North Carolina and one in South Carolina. We provide capacity building, engage in a lot of advocacy issues, but also promote HIV education and develop models for prevention and programming for high-risk communities. So if you ever need anything from us, please reach out. And then I'll turn it over to Lee to share more about the North Carolina AIDS Action Network.
Thanks, Judith. Am I coming in clear? Can you hear me okay?
Yes.
Awesome. Well, thanks everybody again for joining us. The North Carolina AIDS Action Network, as I believe many of you know, is the statewide organization that was formally founded in 2010, although a network has existed much longer than that of affiliated organizations and AIDS service organizations in North Carolina focused on direct policy and advocacy work related to HIV treatment and prevention and broader sexually transmitted infections. Our mission is to improve the lives of people living with HIV and AIDS and affected communities through outreach and public education, policy advocacy, and community building to increase visibility and mutual support of people living with HIV and AIDS throughout our state. One of the roles and one of the things we've tried to take seriously is thinking about ways to educate our network and our broader partners about sort of the cutting edge of HIV treatment and prevention policy. And as Judy, I think, alluded to at the start, she and I for some time have been talking about how we can really think strategically about moving the needle on policies, both at a statewide level and a local level, to increase access to pre-exposure prophylaxis. So we had a unique opportunity to have a couple of questions added to a statewide poll done in North Carolina to help, to my knowledge, for the first time, really get some tangible data around PrEP awareness in our state, and are excited to share this information with you, and also see it as an opportunity to hopefully leverage and create some energy around improving access to PrEP. Judy, before I jump into talking about the poll, are there any other logistical notes or anything you need to cover?
No, just a reminder to our participants to please mute your phones if you're in a particularly noisy area.
Awesome. So I am going to head in the chat function. I have just broadcasted and sent to everyone a link to the blog post that we released on August 9th when we released this data. The next slide has a couple of questions and a couple high-level responses. I think many of you have seen all of this already, but that link is available right now in the chat function if folks want to be able to look at that data specifically. Judy, can you take me to the next slide with the North Carolina survey results? Thank you. So as I mentioned, we had a unique opportunity to add a couple of questions to a poll being done of statewide North Carolina voters. This poll was done by Public Policy Polling, which I think many people know is a very accurate and nationally acclaimed polling firm. Several election cycles ago, they were one of the most accurate pollsters in the country, I believe in the 2012 election. They, like I think about every other polling company, were not particularly accurate in 2016. I think we increasingly saw that the 2016 election was a unique election and that the landscape on this information is changing. So certainly there are a number of ways to generate poll data, and that may vary from place to place. So I would say this tells us one piece of data and is a snippet in time and piece of information that, while interesting, is not universally on its own the only thing we should consider related to folks' thoughts on PrEP access in North Carolina. I'll also note that we were not able to be as detailed in this poll as we might have liked to have been, specifically around gathering information about identity, and I'll talk more about that in terms of the demographic information. So the two questions that we did ask on this poll, which was done at the end of July, and about 400 North Carolinians responded to generate the data, was first off is if you have heard of pre-exposure prophylaxis, which is also known as PrEP. And 9% of individuals responded that they had heard of PrEP, 59% responded no, and 32% responded not sure. I've joked with several colleagues in the last couple of weeks that I think we can probably assume that 32% of not sure are really probably no responses. So, I will say that both, I think myself personally and our organization, was not particularly surprised by this data. Through some of the public information we put out, we wanted to use it as an opportunity to raise a little bit of alarm, because just that data point of 9% being even under 2 digits is really striking. And it, at the same time, is a moment to kind of ask all of us as a movement, to ask our local health departments, to ask advocates for people living with HIV, to really think about how we step up our game. PrEP and pre-exposure prophylaxis is still, even, though it may not feel that way to some of us working in the HIV movement, a relatively new tool that we have at our disposal. At the same time, it's been approved for several years by the CDC. And I think for use in the United States, we're at a moment that we really want to make sure we are communicating to the communities who need access to PrEP most, and that the general public knows that we have a tool, a medication that can prevent HIV, which was just simply unimaginable and not even possible to think about even just a decade ago. The other question that we were intrigued to get some data on was about the role of local health departments in helping to distribute PrEP. We as an organization have thought strategically about some ways to try to increase statewide access to PrEP, and have been having some conversations with members of the General Assembly and been trying to think strategically about some opportunities to increase PrEP access through statewide efforts. I think all of you know that North Carolina is still a fairly conservative political state statewide, and though we led some efforts to try to get increased funding to allow our communicable disease branch to increase their funding dollars related to HIV prevention during the short session, we're not able to get a lot of traction out of that. I think a lot of that has to do with the fact that this was a really short session this year. Those of you who followed the state budget process know it happened very quickly, and we are going to continue to advocate for a need for increased resources and increased work from state government to support the work at the North Carolina Division of Public Health and our communicable disease branch. But know that there are probably other policy levers and tools we've got to think of as well. And in the spirit of sort of all public health and all politics being local, have thought that local health departments, and have seen some really good work at local health departments being an important place to increase access to PrEP. So our second question, which you can see on the screen, asks and lets people know that PrEP is a daily pill known to prevent HIV transmission. notes that several local health departments in North Carolina have started funding programs to provide PrEP to low-income individuals who might not be able to access it otherwise, and then asks individuals if they would support or oppose those programs. We were actually really pleasantly surprised and happy with the response we got on that question as well. 55%, as you can see, support those types of programs, 15% oppose, and 30% are not sure. Again, I think that not sure, probably that's less of a movement of people who are just no in this question, which is a bit more nuanced and a bit more detailed. But still, we think pretty exciting data. The survey, if you look at the link that I shared in the Q&A, if you've not seen the full demographic information, does break down the responses based on race, based on preferred candidate for president in 2016, and party affiliation. The poll had more registered Democrats than Republicans, but also more Trump voters than Clinton voters in 2016, which is actually pretty consistent with the political ratings of North Carolina. We, for a long time, have had more Democrats registered than Republicans, but really a history of Democratic registered voters starting to lean more and more toward voting for Republicans in statewide elections in North Carolina. But we're really pleased to see that while the support was stronger for these types of programs from Clinton voters and from Democrats, a majority of Trump voters and a majority of Republican voters responded that they supported the idea of local health departments providing PrEP and having those kind of services. So I will note that I've seen one question come through in the Q&A. Rebecca asked, I have only been aware of PrEP for a year. How long has it been available? So it's actually, I've recently learned and gained further information to realize that if we're talking globally, different countries have sort of approved pre-exposure prophylaxis at different times. If I remember correctly, the CDC, the Centers for Disease Control in the United States, approved PrEP for usage for HIV prevention, I believe, in 2012. I can double check that when we pass it to another speaker. But it's so certainly within the last decade, but not. There's been some time, and I think we're seeing sort of as time passed more awareness, but still a lot more work to do. Let me pause here and see if folks have any specific questions about the poll or sort of our data points before we move to some of our presenters who are going to share some information about the work of local health departments.
Lee, I have a statement.
Mm-hmm.
This is Rita. Especially about the polling, I actually set up a table last Thursday, and I have some information on the table about PrEP. I was really surprised when I had a lady come up who worked at UNC and sort of that department, and I really didn't get into the logistics with her. And the information that I had about PrEP, she said she hadn't even seen it in her clinic. And she took the information that I was given, and I was actually given it by Michelle Bailey from UNC. And she said she was going to go back and ask why did she not know about this information. So what I'm steady seeing that we're not getting the information out to clinics that even work with or promote PrEP or have HIV clinics itself. So I'm kind of like really concerned about that issue.
Yeah, I think, Rita, that's a really great point. And I think, for those of us who work in HIV or even slightly broader public health with an HIV focus, I do think that it is hard sometimes to take our step out of our shoes, right? We are, living this work on a daily basis. I know we've got some advocates and folks on this call living with HIV. We have folks who are on PrEP. And so it can be hard, I think, sometimes to take us out of our own ethos and realize that for folks who are not as focused on HIV, getting all kinds of information about the changing world that we live in sometimes can be overwhelming, so people miss it. At the same time, I don't think that's an excuse, and I particularly think that we have a responsibility to raise awareness and sound the alarm and make sure folks have information to what they need. I think one other contributing factor that I think has been noted on a number of times is that I think many folks know that Gilead Pharmaceutical Companies is the manufacturer of PrEP. Initially, for the first several years, they did not really actively promote the medication. I'm not going to pass judgment on that one way or the other, but sort of from what I've been able to consume and understand, there were some HIV activists who were not 100% on board with PrEP and were fairly critical of it as a tool in its first couple years. I think a lot of that criticism, as folks have really seen what a powerful tool it is, has abated. But with that criticism, I think came a reluctance to be too aggressive in terms of commercials or putting staff infrastructure in place. And I think a lot of folks know that over the summer, Gilead ran a pretty robust statewide, countrywide ad campaign, both about healthy sexuality in general and about PrEP. And so I'm hoping that that may be able to help move the needle a little bit in terms of moving this forward.
My last comment, do you also think that we've gotten so comfortable where we think it's not my department to do this or it's not my responsibility, that clinic over there is responsible for it, instead of ensuring that everyone has this information available to the community that they serve?
Yeah, I think that's actually a really good point, that certainly we know so many excellent HIV specialists and our statewide staff doing HIV work in North Carolina who are robust champions of PrEP. But when you get into sort of the more general health department setting or clinician setting, I think we've got less access. So I do want to address, there's one question that came through in the Q&A, and then want to move on to our next presenters just to be cognizant of time. I alluded to this briefly earlier, but do want to discuss it more. Someone asked, can you discuss why the poll doesn't grab data around identity, race, gender identity, sexual orientation, etc.? If you go to the link in the Q&A and see the full survey results, you can see that we did get some demographic information based on age and on race. I will say that our data around that point is sorely lacking. We had a really unique opportunity to just put a couple of questions onto a poll already being commissioned. So we were not, as an organization, either INCAN or the Latino Commission on AIDS, full deciders on what kind of demographic information we could get. As I think many of you know, making sure we are talking about people's unique identities and understanding, particularly data around our trans community, on the LGBTQ community as a whole, is really important. Junie and I have been discussing actually that based on this information, we may look at using some of our financial resources to consider doing another poll like this at some point in the future. And certainly if we do that, I think we would be much more intentional about the demographic information we could capture, because that is just so vital to making sure that the communities who need access the most get it. So I'm going to pass the baton to our next presenter. There is a brief slide that I have what's next, just about kind of our high-level takeaways. As I said, the data was not really surprising to us internally, but we really believe that sort of sharing it could help motivate and generate some hopeful more activity in recent years around PrEP access in general. I also think it's a valuable moment to know how relevant survey data can be as a tool for public policy campaigns. I now get to have conversations with policymakers and point to some pretty empirical data about gaps and needs for more work. And that we certainly hope as an organization and as coalitions that we're going to start seeing more local health departments actively educating their community and directly prescribing PrEP. So we wanted to take some time now to hear from some local leaders in a couple of health departments who I think are doing some really impressive work and hard work, because this is still a really relatively new tool to ramp up their PrEP programs in local health departments. First, I'm going to pass things to Matthew Jenkins. Matthew is with the Mecklenburg County Division of Public Health. Mecklenburg, I think as many folks know, is certainly our largest county in the state and has one of the highest rates of HIV, not just in North Carolina, but the South. Mecklenburg's been doing a lot of impressive work around HIV treatment and prevention for many years, and actually has seen some really interesting momentum around their PrEP work. So, Matt, let me pass it to you to share with us some of the things that y'all have been doing through the Mecklenburg County Public Health.
All right, thank you. Good afternoon, everyone. Just a little bit about our process regarding our PrEP pilot program here in Mecklenburg County. Back in December of last year, the Board of County Commissioners, who also serve as our Board of Health, approved funding to be used for high-risk uninsured individuals to access PrEP.
Yes.
And I think that amount at that time was about $248,000. So after we obtained that approval to use these funds, the leadership at the health department decided that it would probably be better for us to contract with some local clinics who had a history of already providing PrEP services in the community. And we arrived at that decision largely in part due to some of the internal infrastructure changes that were being made within the health department. So what we did was initially we identified 4 clinics that we already had contracts with for other services, and we identified those clinics based on what we felt their capacity would be to reach high-risk uninsured individuals for PrEP. And we reached out to those clinics and had some conversations around whether this was something that they would even be interested in, whether they thought they had the capacity to reach who it was that needed to access PrEP. And pretty much all of them agreed that they would be interested in moving forward with a contract to provide PrEP access to high-risk uninsured. So we began the process of contracting, and if anyone knows anything about doing business with Mecklenburg County government, it can be a very laborious process. So we began to move forward with amending existing contracts with these 4 clinics. And during that process, because of the sensitivity of the services that were going to be provided under this initiative, it made more sense for us to have separate contracts with those clinics. So instead of amending contracts, we actually had to start a brand new contract with these entities. And of course, that process involved many steps, which kind of delayed the timeline that we had hoped for to have the contracts in place. Because after the money was approved in December, we actually started the contract process in January. Our first contract wasn't actually approved and executed until March the 13th, and that was with Easttown Family Physician. Shortly thereafter, we were able to execute our second contract with Amity Group Foundation, which is the nonprofit arm of Ballantine Family Medicine. On April the 6th, we executed our third contract with C.W. Williams Community Health Center, which is a FQHC here, and we had hoped to be able to contract with our other FQHC partner, Charlotte Community Health Center. However, that process stalled due to a requirement that the county had, which took a little longer for us to be able to get them on board. It was around a cyber certificate that the clinic needed in order for them to be able to do some services with us. So what we did, we went back to the table and we identified 2 additional organizations that we could contract with, and we actually split the funds that we were initially going to provide to Charlotte Community Health between those 2 organizations. On May the 7th, we were actually able to execute our 4th contract with Quality Comprehensive Health Care. And Quality Comprehensive Health Care is a local nonprofit organization, but they also do some work with several other clinics, and they had already begun doing some work around PrEP. And finally, on August the 3rd, the contract with Rosedale Assistance and Opportunities was executed, and Rosedale Assistance and Opportunities, known as RAO, is the nonprofit arm of Rosedale ID. We're still working through some logistics to contract with Charlotte Community Health Center, and we're hopeful that we'll be able to bring them on board here shortly. In terms of the marketing for the PrEP pilot, early on, after we got the approval to do to use these funds for high-risk uninsured, we began having conversations prior to contracts being executed or actually during the process that we were working on the contracts. We had individuals from the Health Department's Public Information Office as well as members of the community to try and determine what the marketing campaign would actually look like. We created a, I guess you would call it a marketing ad hoc group, and we had individuals from the faith community, individuals from some of the local community-based organizations, and then some health department individuals at the table as well. We looked at information or marketing material from other areas, other cities, primarily Baltimore, who had done some work around PrEP. And they had a pretty robust campaign where they used local individuals in their marketing material. So we kind of gravitated toward that particular one. So in March, we developed a half-page flyer with the headline, Healthy is the New Sexy. And that flyer basically had some basic information about PrEP, some information about the PrEP pilot that was being launched through the health department. It also listed the names, contact information of the clinics that we were intending to partner with. And we kind of moved that forward really quickly because we were coming up on a large event that normally takes place here in Mecklenburg County every year, and it was the CIAA event, and which draws a very large crowd. So we wanted to get the information out while we had access to that large crowd. So we aggressively moved to get the information out to a number of bars and venues around the city. We continued our work, our marketing strategy, and some of that included the creation of a photo shoot with some of the providers that were actually providing the PrEP. You know, some of the providers from those clinics that we had identified. We included individuals that were already doing some work around HIV prevention from some of our community partners, and we included community members that represented the population that we wanted to reach. Some trans women, Latino MSM, Black MSM, and we used the images from the photo shoots to kind of develop a bus ad, which is currently running on the sides of a few buses here locally. And I believe it's been running since the beginning of August, and we're currently looking to extend the time frame in which these ads would run through the end of September. We also had a presence on some of the social media sites such as Jacked, and we're currently working on using these images on some flyers that our PI department has created, which we're going to distribute to some of our community partners so that as they do outreach, they can, you know, take this marketing material out with them to do outreach. Our outreach team is distributing some of this information once we receive final approval. And those images are also being formatted so that the clinics that we're currently partnering with, as well as any other clinic, can use those images on their websites to help increase the uptake of PrEP usage. So though our marketing campaign took a little while to get off the ground, it seems as though the word of mouth about the PrEP pilot was pretty effective because as of August the 3rd, we had 42 individuals enrolled in the PrEP pilot initiative so far. And we do anticipate that the number will actually increase as our marketing efforts continue to increase. And I believe of the 42, I think 2 of them actually discontinued PrEP use. I'm not sure what the rationale was behind them discontinuing it. But, I mean, that's just a real quick down and dirty. That's our process. We're still working to try and get Charlotte Community Health Center on board. We were very adamant about the fact that the 2 local FQHCs needed to be a part of this process, largely because of the population that they serve. So we're excited about the marketing campaign as it continues to roll out. And we meet regularly either face-to-face or via phone call with those clinics that's actually providing the service for us. And so far it's been pretty good. I mean, the biggest challenge or the hurdle that I saw was getting the contracts through. We wanted to make sure that we were meeting all of the requirements and logistics that the county has in terms of individuals being able to do business with the county. So that was our biggest hurdle. And that's pretty much our process and what we've done thus far.
Awesome. Matt, thank you so much. I know I've been spoken with both you and a number of other colleagues in Mecklenburg and know some really great work is happening, but it's also a reminder that sometimes things move slow even when I think y'all had a lot of great folks around the table. So it's exciting to see how this keeps ramping up in the months and years ahead. For time purposes, I'm going to wait and do Q&A for all three of our local speakers at the end. So I'm now going to pass things off to Whitney Schwalm. Many of y'all, I think, who've been following PrEP work locally in North Carolina have heard of some of the great work that the Cabarrus Health Alliance and Whitney did when she was with them. She has actually recently left Cabarrus, but when I reached out to them for suggestions about speakers, everybody said, Whitney is the person who really led this, so she's the person who should share some information. So Whitney, thanks for joining us, and I'll pass things off to you to hear about some of the work y'all did in Cabarrus County.
Thanks, Lee. Good afternoon or good morning, everyone. My name is Whitney Schwalm. I'm a current medical student at the University of North Carolina in Chapel Hill, but I was stationed at the Cabarrus Health Alliance for 2 years as a CDC Public Health Associate. So that's when I first learned about PrEP in 2015 and decided, wow, this is a really great intervention, that we could implement within the health department for a great HIV prevention initiative. So I'm going to kind of walk you through the timeline of how we implemented and a little bit of where we are today for the PrEP clinic. So like I said, in December of 2015 is when I learned about PrEP. So I put together a presentation of need for our health department. At the time, the Charlotte metro area, including Concord, was ranked number 14 in the nation for a diagnosis of HIV infection. So that was a huge sticking point for, why we would want to include this tool within the health department. So we got approval from our medical director and our health director, and we formed our PrEP work group. And something that worked really well for our health department was including not only our clinical staff, but also our lab staff, our finance staff, medical records, and all of the nurses within the STD clinic. So our work group consisted of everyone that would be involved from when a patient walked into the door to when they left. So once that work group was formed, I worked on getting some training for our staff, and one organization or two organizations that were really critical for that assistance were, number one, the Center for Health and Behavioral Training. They provide capacity building assistance specific for local health departments around implementing PrEP. So they're based out of New York. Their services are completely free. They are funded through CDC, and they will come to your location and do a couple-day training, including your clinical staff, your medical records staff, your billing staff. So that's a really great resource to utilize, and all you'd have to do is submit a CRIS request through our state representative. So that's available. And then the other resource that we relied heavily on was NCATech, the North Carolina AIDS Training and Education Center. They have some really great resources around patient education and especially clinician support for questions about how to prescribe PrEP. So once we had our staff trained, one more resource I'd like to mention. NACCHO also has a series of webinars specific for health departments around implementing PrEP. So that's another place where we went to learn and get some training around it. So once we were all trained, we requested the state to use 340B funds to purchase Truvada, and we keep a couple of bottles on hand in the clinic, and that's in case any of our patients run into any kind of issues and need to be bridged on the medication for a couple of days. So we don't actually prescribe through our pharmacy, but we will keep Truvada on hand to bridge patients should they need that. So we got approved to use the 340B funds, and then we started compiling resources. So we built some clinical cheat sheets for our providers. We gathered some helplines, reference guides, things like that. And all of these materials I've put on a Google Drive, which is the link that you see on the slide, and you're welcome to look through those. If I can answer any questions, please let me know, or I can connect you with someone at CHA that might be able to help with any of those resources available on that drive. It's got patient assistance materials as well, educational materials, support resources. And then another place I compiled those resources was on our website, and I will talk about that in a minute. So then in March and May, we finalized all these policies and protocols, and we also started building our relationship with Gilead. And Gilead is really wonderful in helping you work through any issues you're facing when you're trying to request patient assistance. They're really great. Their assistance program helps people get free drug up to 500% of the federal poverty level, and the turnaround time on that is very quick. So for patients who don't have access to insurance, you can get them on Truvada. And then the thing that took the biggest amount of time for us was getting our HIV testing in place. So our health department didn't have any kind of rapid testing in place. And in order to get patients on PrEP either same day or same week, we needed to have a negative HIV test. So we implemented rapid HIV testing through the state. So you can get free tests through the state. The cost for that comes in your CLIA waiver, your HIV testing license, which are a couple $100s a year. So that was mainly the big upfront cost in getting the clinic up and going. But other costs, we didn't have to hire any new providers, anything like that. We used the existing infrastructure of our sexual health clinic and just integrated those services within there. So no major upfront costs in getting that up and running. And then in June and July, we launched our website, and if you want to take a look at that, it's www.cabarrushealth.org/PrEP. And there's a ton of different patient-facing resources on there that we've compiled so that folks can go on and learn about PrEP. We got approved to do the rapid testing program through the state, and we finalized some of our lab codes and things like that. And then the biggest piece of this was that we educated all of our clinics within the health department, not just the sexual health clinics, and we made sure all of our frontline staff were trained so that when folks were coming in asking about PrEP, people knew where to direct them or where to refer them. So then in August is when we actually launched and opened our doors. We did a big press release through the paper. We were on Facebook. We educated all of our local disease intervention specialists. We sent a blast out to all of our local providers in the area, and then built relationships with some of our HIV organizations in the area as well and let them know that we would be providing PrEP. For marketing specific to the LGBTQ community, Scruff lets you run free advertising in English and Spanish. So we took advantage of that, and we run advertising campaigns on Scruff. And then we went live. And so the cost breakdown for patients for what our health department looks like is about $65 a visit. And that's mainly to cover the cost of the labs. We don't charge an office fee or an office visit. We're not making money off of PrEP visits. And the main chunk of that cost is really STD testing. Our health department doesn't receive funds to cover STD testing for men for free. So we basically decided to take the cost of what it would cost to provide PrEP over a year and break it down so that patients were paying a similar fee every visit instead of being heavy loaded at the front and having to pay a couple $100s in the first couple of visits. So really we're just covering the cost of labs. If your health department is one that has funding to cover testing for men, you might be able to provide PrEP for a much lower cost, potentially around $10 or $15 a visit. Or if you have funding or seek funding, that could potentially bring the cost down significantly. We do recognize that $65 is still a lot of money for patients that don't have insurance or don't have access. But we do, from last time numbers I heard, we have around 29 patients that we've seen over the past 2 years that have been accessing our PrEP services. So outside of, like we said, the cost and the funding issue for STD testing, the other major barrier that we see is that folks have a hard time understanding their risk when we bring up discussions around risk. So there is a CDC tool. It's a risk calculator that our nurses have started using in discussions with people who they think are eligible for PrEP. So we utilize that and then always leave people with information and education if we think they'd be a good candidate. So our main source of referral for patients is within our STD clinic through our women's health clinic. Our DIS folks refer to us, and then word of mouth is a big referral, and then for people who just Google us as well is another source of referral. And then something else to mention is that we have a family nurse practitioner in our clinic who's with us 2 days a week who establishes patients in care. We also have a PA in our clinic once a week who will establish patients in PrEP care. And then a lot of the follow-up visits can actually be run by enhanced role nurses. And I've built a standing order specific for enhanced role nurses to do that follow-up care, and that is available in that resource drive. So like I said, utilize the existing infrastructure, kind of a minimal upfront cost to implementing, and we're about at 30 patients over 2 years.
Awesome. Well, Whitney, again, thank you for sharing some of this information and some of the great y'all work that I know many folks are involved with in Cabarrus County. And last, I'm going to pass things to Dr. Barbara Johnston from the Lincoln Community Health Center and Cedar Eagle from the Durham County Department of Public Health to talk about some of the local efforts that have been happening around increasing PrEP access in Durham.
Hello, can you all hear me? This is Barbara Johnston. I have Cedar Eagle with me.
Yes.
So, great. So we actually started in late 2014, early 2015. And it started with a kind of convocation. Dr. Arlene Senya from the health department pulled everybody together from all the local institutions. And we have, we're very lucky to have UNC and Duke University, and then Lincoln Community Health Center, where I am from, is actually the main safety net provider in the community and takes from all around the area into counties all around here, as well as in Durham County as well. So we wanted to promote PrEP in all those institutions, so particularly with Lincoln, were some situations that we had that were very favorable. So our clinic, we had an early intervention clinic for many years that I'm the director of, that is co-located with the health department. So we have a long history of cooperation. And we were just beginning a primary care clinic within our same, literally right next door, and right next door to the adult health, the sexually transmitted infection clinic. And so what we decided is to really kind of, join resources and join forces, because alone none of us quite had the means to do it, but together we felt like we could. So we went to Lincoln and sold the chief medical officer and the CEO on the idea of partnering with the health department. And what we said was that we could do this in a cost-effective way by relying on the health department to do some of the initial testing, which they were already doing. So they were already doing the HIV testing, and they were doing urethral, but also non-genital testing, which we felt was very important. So they were doing pharyngeal and rectal testing. And if we had to do that alone, it would have been a very hard sell, but the health department said, we'll do it. We created memorandums of understanding, and that we would then take on both the primary care, which we thought was a really strong feature of what we were doing, plus the ongoing PrEP. So, and we met a number of times over the year, over the first 6 months, but we really wanted to get it going pretty immediately. So our main source of patients, particularly early on, was the health department. And they had a very active health department, sexually transmitted infection screening clinic. So, cutting to the chase, because we don't have too much time, we met approximately every 3 months to kind of fine-tune. What we soon realized was it was going to be hard to send everybody through every 3 months to the health department, plus to come to a primary care clinic. So we pretty soon kind of, we began to do more and more of the testing ourselves, but then the health department began to help us out with doing the non-genital STI testing. So it made it still cost-effective for us. And, to cut to some of the chase, we have seen, we've had we're having a major poster presented at the the National Association of Community Health Centers, as we speak, Destry Taylor, who's been the main person who's providing care, the primary care and the PrEP, is presenting that poster in Florida. And what it shows is that 197 patients were referred from the health department, and we were reporting on 117, and that we've had in PrEP. Now, we've actually, some sort of more informal records that we keep have seen over 150 because we have had a growing number kind of referred from within Lincoln. But this is the group that we had good data on. What we found is that we are doing what we wanted to do in terms of getting to the people who have been, not accessing PrEP nationwide in studies. So in our population, over 50% are African Americans, and 18% are Latinx. So, and a fair number are also trans individuals, both trans females and trans males, which has really been coming up more in the last year because Destry Taylor is particularly expert at that. And I still mention too that along with this, I think it wasn't just the medical centers that were doing this. Duke also had started a PrEP clinic in this time with funding that they had, and have gotten some great support and advertised on social media. We didn't do that, but we did kind of partner up and we were also part of the whole campaign that was called Durham Knows. So we got a small amount of funding initially, and then because of the work of people like Michael Wilson at North Carolina Central, we were able to get funds that came over from a project at North Carolina Central through this criminal justice initiative to continue it. And we then had a public health campaign that was both to increase testing and to increase knowledge of PrEP primarily. So we came up also with posters and had bus campaigns that had people go out from the HIV/STI committee that promoted this campaign into when we've had events around testing and around World AIDS Day. So that's really, for not having very much money, we were able to sort of improve the impact. And I'm going to give it over to Cedar for a couple minutes.
So one of the early things we did was to request some capacity building assistance as well from AIDS United, and we met with all of the local stakeholders for a day. And then to keep that momentum going, we created a work group called PrEP that meets monthly to discuss issues around PrEP and to brainstorm solutions. As Dr. Johnson said, the health department provides STI, HIV, and viral hepatitis testing, and then counseling as well on PrEP, and then they are referred over to either Duke, UNC, or Lincoln Primary Care for PrEP services. And as of Friday, we have actually made 245 referrals since May of 2015. So we're doing rather well with this system. And, of course, we do take advantage both at Lincoln and at other clinics of the Gilead Patient Assistance Program, which is extremely helpful in getting folks who are uninsured or underinsured assistance in obtaining Truvada. Some of the barriers that we've run into, I think, is retention. That's one of the things that we've run up against in that people may not continue to follow through after initially expressing interest in PrEP, and so we hope to kind of strengthen some of our navigation programs in order to follow our clients through the process to ensure that they are being retained on PrEP.
Yeah, and we have really advertised this. I mean, advertised is not quite the right word, but we've tried to educate our colleagues throughout Lincoln of how important this is. And just as of the last week, we're really moving to make it more part of the routine care there. I mean, we have a pretty streamlined process that works well through our collaboration, but we wanted to make sure that it was getting out, particularly to adolescents, and some of the there's a adolescent specialist who's interested in this and making sure that we're able to make it more accessible at at some of our satellite sites and through Maine Lincoln as well.
Awesome. Well, thank you all for sharing all that information. I want to transition now to going into Q&A to see if we've got any questions for any of our speakers from the 3 counties. I do want to start out, Whitney, if you are still on the line, we had a question come through the chat function. If you could list the 3 organizations that you mentioned in the beginning that helped with the staff training y'all did around PrEP and Cabarrus.
Yes, absolutely. It's the Center for Health and Behavioral Training. They're located out of New York, and on their website you can find a specific page that lists their course on HIV pre-exposure prophylaxis for health departments. The other organization I mentioned is NCATEC, the North Carolina AIDS Training and Education Center. And then the third resource I mentioned was NACHO, National Association of City and County Health Officials. They have a 3-part webinar series around PrEP implementation and financing PrEP services.
Awesome. And then we had a second question actually come through the chat function. And Matt, this is for you. Brandy Sessoms has asked, I oversee PrEP provider resources and refer patients to PrEP providers from my area. Can a patient receive PrEP at Mecklenburg County Health Department or partnership providers only?
Currently, we're not providing PrEP services in the health department. They can receive PrEP services through one of the providers that we're contracting with. However, they have to be a Mecklenburg County resident. And that information, they process all of that within one of those clinics. So I can share the information regarding who we're contracting with afterwards. If you would just send me an email, I can share it with you. But they have to be a Mecklenburg County resident and meet those guidelines.
Awesome. Cool. And just as a reminder, all of our speakers, their email addresses are included in the webinar slides. Certainly Judy and I are happy to help facilitate that as well. I do want to apologize to Barbara. I think initially I have the correct email for you, but your name is missing a T in our webinar slide, so my apologies about getting that slightly off. So if folks want to do additional direct follow-up to them, feel free. We also have a chat question, and then I'll open it up to on the call. Someone has asked that they are a substance abuse specialist. Are there stats on methods of HIV transmission? Can Truvada help with non-sexual, so particularly looking at like injection drug use or needle exchange transmission? At this point, sort of my understanding is that the data is not definitive about Truvada's usage to prevent HIV transmission through the sharing of needles. I believe there's some guidelines that it probably is still a good practice, but there's not per se a scientific study that's been done that directly looked at PrEP usage from an injecting needles perspective. I had a colleague who is a medical provider who is more smart about some of the science stuff than I am on this front, who did comment that it may be that while certainly Truvada is helpful, we may not be able to as definitively have as good of an assumption that it will almost, when used correctly, when taken as a daily pill 7 days a week, the current science has shown just a minimal number of transmission occurring from sexual intercourse. HIV, in terms of transmitting HIV, if someone is using a needle that was used by someone else who is living with HIV, I think my understanding is that it is much more likely form of transmission to use for someone who's sharing a needle than sexual contact. So my understanding, and I know we have a number of experts on the phone, so if actually anyone else wants to address this question, feel free, is that it may be that we're not going to be able to be as definitive and confident in PrEP's usage for an injection for someone who might be in a position where they would become HIV positive through injection needles. Let me open it up. I hope that was a not completely clunky response to that question. Does anyone else have information or want to share thoughts on that question?
This is Dr. Johnson. Yeah, pretty much my understanding as well. I think you had it about right.
Hello, Lee.
It's helpful to know when, I'm an advocate and not necessarily a scientist. So I do see it looks like we've got a couple questions coming in on the queue, and I'll address those in a second. So while I take a look at those,
I have a question from the Triangle Trauma Center.
Yeah, hey, Terry, go ahead.
Hey, thank you all for putting this on. It's very informative. So my question is, as it comes to data for the African-American young men of color, and I wanted to know, we talk a lot about health departments and we talk a lot about organizations that are strategic in implementing PrEP or either educating around PrEP, but is there any talk about funding to help these groups do that? The other part is, to my question, I had to walk away, I was too close to the computer. The other part to my question is anyone looking, I did meet with Jacqueline Kleinmore and Pete Moore a couple of months ago on what is the state leading and educating us around PrEP. I was trying to, as a community-based organization, fill out funding from a national organization. That question said, well, what is your state perspective? What is the protocol for your state around PrEP? I know the work you're doing, Lee, but I just needed some more information. If anyone else has experienced some of the backlash or some of the lack of services and information around Black agencies reaching Black communities of color around PrEP.
Yeah, Terry, thank you for both raising that issue and asking that question. At a high level, I think what I would respond is that, unfortunately, from a state Department of Health and Human Services and Communicable Disease Branch, and then the work of HIV treatment and prevention, we have really strong allies who I think absolutely want to do more. Unfortunately, they are so often, I think, hindered by the available funding that they have at their disposal. I alluded to this at the start of the call, but North Carolina AIDS Action Network tried to proactively get increased funding to address both some of the hepatitis C work that we believe is really important happening within the Division of Public Health, and to address HIV prevention during the legislative short session last year. We were successful in maintaining an increased investment of hepatitis C funding that we were able to secure 2 years ago, but because of the timing did not really get any traction about new state dollars for the HIV prevention, which is how we really framed it, thinking about both PrEP and prevention broadly. We are going to redouble that effort in 2019. I think the legislature will likely, from what I'm forecasting, be a little bit more competitive in terms of the state house being having a greater Democratic majority, which we anticipate might be helpful on this topic. So part of the focus of the conversation today was, I think, we are looking as an advocacy community and realizing that our local health departments can be really critical roles when I think we're concerned that we're not going to get a lot of traction from our General Assembly in terms of moving forward with something big and ambitious on PrEP. That's my initial thought, but again, I'd open it up to our other speakers, or if there's anyone else on the phone who maybe wants to provide comment or address that question.
All right, well, if not, I'd like to also, just in the interest of time, also include some of the other questions that we've had in the chat function. We do have a question asking, does anyone have information on Guilford County PrEP access? I know that the Triad Health Project is doing some work around that, and I know Lucero is on the line, or was on the line, and she was doing some work around trans women in PrEP and gaining access, particularly, it may be the trans Latinx population in the area. So I would defer to that and open that up to see if anyone else has any other additional resources.
Hi, this is Brandy. I'm actually in Guilford County. So Regional Center for Infectious Disease through CONE just launched a PrEP clinic about a week or two ago. So they're open and they're seeing patients as well as Planned Parenthood and Guilford County. They'll see patients there as well for PrEP. Here at Guilford County, we have a very soft, open PrEP clinic, which we actually do not advertise publicly because we only see our established patients for PrEP.
Okay, great. Thank you.
Hello. Just just a comment. If people would, and I know this had been offered, but if people would find it helpful to even have phone conversations or that kind of thing to troubleshoot. I mean, particularly about approaching community health centers or established places. I know there's a lot that would be, I would be very, glad to help. Just to reaffirm that the NCA Tech people are really, terrific resources, and they know a lot of logistics as well as overall training.
Great. Thank you, Dr. Johnston. We have one more question from the chat function, and they're very similar, but I'll open it up first to our presenters. And it asks, are there resources for providers around providing PrEP for adolescents? And the second part to that is, do you anticipate any new opportunities to provide PrEP for young adults now that the FDA has approved its use for people under 18? And what are some of the barriers you all will see or foresee to implement PrEP for this age group? So I don't know if maybe Dr. Johnston or Matt wants to.
Well, we're just starting with it since it's just kind of opened up, and I anticipate that my colleague Dr. Ito is going to be a great resource because she knows inside and out, how the consents and so forth, or how those create barriers, and how, she's been really active in contraception and other things. So I'm hoping she's going to be starting with this and very enthusiastic. So I don't think we have a lot yet, but as some of us get more experience with it, I think we'll. Hopefully we'll have things to offer.
This is Lee. I think the one other thing I just offer on that is, we continue to want to think about, so PrEP has been, as alluded to, approved for adolescents under the age of 18. We do know that for many young people, their comfort level and very likely being on their parents' health insurance may impact their ability to access the medication. So, there are a number of ways to think about addressing that concern. Certainly thinking about ensuring that our young people have quality sexual health education and that we're creating a culture where young people and parents can have good conversations is a big challenge, but it's certainly something the HIV community's cared about for a long time. And I think this is just a reminder that continuing to support that type of culture and to support quality sexual health education is really, really important as well.
Great, thank you. And it looks like we have a few more minutes for questions. So if anyone has any additional questions, feel free to put them in the chat, or if not, you can ask them live. Well, it doesn't sound like we have additional questions. So I want to thank everyone for joining us. I'd like to thank our presenters. And if you have additional questions, feel free to reach out to Lee or myself or any of the presenters on the line. We did include their contact information. As a reminder, this webinar was recorded and will be distributed to those who registered, as well as, I believe, we'll put it on our YouTube page. And Lee, you'll put it on your website or share it with your network in some capacity. So thank you all so much. Lee, I don't know if you have any final notes.
No, I want to thank everybody for being on the call. Thank y'all to our presenters. This has been a topic, Judy and I have been in conversation, as she mentioned, for several months about thinking how we can ramp up this work. I know we have a number of folks who are on the call from some local health departments around the state. You know, if we can be helpful in terms of thinking about your ability to ramp up your work in this space, really don't hesitate to be in touch. Certainly a number of our speakers, I think, are stronger experts in terms of the implementation of what it might look like for a local health department to start prescribing or creating different infrastructure or local partnerships. The last thing I thought I'd note is that the North Carolina AIDS Action Network, we host every fall a day-long advocacy and educational conference. This year, that conference is going to be in Durham in November. It's at the Duke School of Nursing on Saturday, November 17th. That conference always provides a really great opportunity to get together a diverse group of movement leaders, people living with HIV, people on PrEP, our medical providers, other activists. And I certainly know that PrEP will be a major item on our agenda for that. So we'll be announcing registration opening in early September, and have sent out save the dates as well. But just hope that if you're interested in getting more involved in that space, in this space, would love to see you at that event as well. So with that, Judy, no other final remarks from me.
All right. Well, great. Thank you, everyone.
Thank you.